Hello student, today we discuss about the types of immunity that comes under the topic serology and immunology. So in this unit we mainly discuss about the what are the types of immunity and which organ, molecules and cells help in providing the immunity. So now we start. First we have to understand what is the immune system and what is immunology, what is immunity and how the immunity responds. So first this all term you have to understand. So immune system is nothing but it is a cell, tissue and molecules that mediate resistance to infection. The cells, tissue or molecules which react when some foreign antigen or molecules interact with our body and our body react towards that foreign molecules, that is known as immune system. Clear? That is known as immune system. And immunology is the term which includes the study of structure and function of that immune system. What? Which include the study of structure and function of the immune system. That comes under the immunology. And immunity is when our body provide resistance against that foreign particles. When our body provide resistance against foreign particles, molecules or pathogen or anything like foreign particles. That resistance is known as immunity. An immune response when our body react toward the foreign particles, molecules or pathogen, that reaction is known as immune response. Clear? That reaction is known as immune response. Collective and coordinated response to the introduction of foreign substance in an individual mediated by cells and molecules of the immune system. In simple words, in simple language, the reaction or response towards the foreign particles, the response of our body toward or against the foreign particles, pathogen, that response is known as immune response. Clear? So what is the role of immune system? The main role of the immune system is defense against microbes, defense against the growth of tumor cells, kill the growth of tumor cells, right? What is the response? What is the response towards the foreign particles? How we react towards the foreign particle and how we defend against that microbes. How the body provide immunity against that foreign particle. These all are the role of the immune system to react or kill that foreign molecules, kill that foreign pathogen, so that they can't interact with our body, can't harm our body. Immune system act as defense system. Like our country, the border of our country is protected by army, right? The army is act as a immune system, because they defend our country against terrorists, right? According to like that only, immune defends our body against micro pathogens, tumor cells, like that. These are the role of the immune system. Homeostasis means destruction of abnormal or dead cells. Dead cell or white blood cell, antigen antibody complex. They form antigen antibody complex and remove that dead cell. Clear? This all are the role of immune system. There are three types of molecules, organs or cells that comes under the immune system. That's organ, cells and molecules. The first organ that comes under the immune system that react against their foreign particles is tonsil and adenoids. Tonsil and adenoids, thymus cells, most important, lymph nodes, spleen, Peyer's patches, appendix, lymphatic vessels, bone marrow. These all are the organs that comes under immune system. And cells are lymphocytes, monocytes, macrophages, granulocytes. In lymphocytes, T cell, B cell, plasma cell, natural killer cells, this all are comes under lymphocytes. And monocytes and macrophages. Granulocyte cells में, in granulocyte cells, neutrophil, eosinophils, basophils, this comes under granulocyte cells. Yeah? And the molecules that act as defense against the pathogen are the antibody that's secreted by the B cells. Clear? Complement system, cytokines, interleukin and interferon. These all are the molecules that defends immune system, our body against the pathogen, react with the foreign molecules and kill them or form a complex and remove from our body. There are two types of immunity: innate immunity and acquired immunity. Clear? Innate immunity, that is non-adaptive immunity, means the immunity that present in our body from the birth or the first line of immune system is known as innate immunity. These are non-adaptive. First line of this is innate immunity is known as first line of immune response. Remember this. Innate immunity is known as first line of immune response. And this relies on mechanisms that exist before infection, that exist in our body before infection. This are not adaptive immunity, means when infection will take place and after that this immunity will be occur. That immunity is known as acquired immunity. And this is the second line of immunity. If this innate immunity is fail, then this acquired immunity will be response. This is the second line of response. And this relies on mechanisms that adapt after infection. And this acquired immunity is handled by T and B lymphocytes. T and B lymphocytes that produce antibody. What? These B lymphocytes produce antibody so that they act against that foreign particles, pathogen, to kill them or remove them from the body. And acquired immunity is also a one cell determined, one antigen determinant. Means one cell, one antibody only determine one type of antigen, not more than one type of antigen. These are the key term of the acquired immunity. So now in detail we study the innate immunity. Based on genetic makeup, relies on already formed components, rapid response within minutes of infection. When infection will take place, within a minute, the innate immunity will respond. This is not a specific immunity. Same molecule, same cells responds to a range of pathogen. Means wide range of pathogen are responded by a same cell or molecules. So it is not a specific that one molecules will respond against one antigen or one pathogen. No, not at all. It has no memory. Innate immunity having no memory means if once pathogen will enter in our body and they are killed by a innate immunity, then there is no memory cell will develop in our body. so that in second times of infection by same pathogen, the body will react and not that infection will occur in our body. No, not like that. They not having a memory cells and does not lead to clonal expansion. The mechanism of innate immunity. The main mechanical barrier and surface secretion of innate immunity is skin, acidic pH in stomach, and cilia. These are the main mechanical barrier of the innate immunity. Humoral mechanism are lysozyme that is an enzyme, basic protein, complement, interferons. These are the humoral mechanism, how the body or how the body responds in innate immunity against the pathogen. Cellular defense mechanism is natural killer cells, neutrophils, macrophages, mast cells, basophil, eosinophil. See this diagram. This is a natural killer cells. This is a eosinophils. This is the neutrophils and the basophil and mast cells, monocytes, macrophages. Clear? Clear this? What is the mechanism? What are the different types of barrier are present in innate immunity? First, in mechanical barrier. In mechanical barrier, skin, acidic pH, cilia. In humoral mechanism, lysozyme, basic protein, complement, interferon. And in cellular defense mechanism, natural killer cells, macrophages, mast cells, basophil cells. Okay. Now, adaptive immunity. Adaptive immunity is the second line of response. When innate immunity will not respond against the pathogen, then after that this acquired immunity will be develop their response, and this is called as a second line of response based upon resistance acquired during life. Upon resistance acquired during life means this type of immunity is developed after the birth or during the lifespan. Relies on genetic events and cellular growth. Responds more slowly over few days. Innate immunity responds within a minute, but this acquired adaptive immunity responds more slowly over a few days, and it is very specific, means one antigen or one molecules will respond only particular type of antigen, not a wide range of antigen. So it is a very specific, has anamnesic memory, repeated exposure leads to faster. First response is lower, after that they develop memory, and when second times that infection will takes place, then they respond faster. Repeated exposure leads to faster, stronger response and leads to clonal expansion. These are the types of adaptive immunity. There are two types of adaptive immunity: active immunity and passive immunity. Active immunity having a clinical, subclinical and infection, and passive immunity is provided by a breast milk, placenta, right? And artificial immunity are provided in adaptive immunity by the vaccination. The types of vaccine is live, killed, purified antigen vaccine. And in passive immunity, artificial immunity is provided by immune serum, immune cells. These are the types. Adaptive immunity mechanism. What are the mechanism? How they react and how they form an antibody against the foreign particles. So, first is cell-mediated immune response. That is CMIR, cell-mediated immune response. And this cell-mediated immune response is the response that takes place by the T lymphocytes. What? T lymphocyte. Eliminate intracellular microbes that survive within phagocytes or other infected cells. Clear? Remember this, cell mediated immune response is response by a T lymphocytes, and these T lymphocytes eliminate intracellular microbes. What? They eliminate intracellular microbes that survive within phagocytes or other infected cells. Second is humoral immune response, and this response is mediated by B lymphocytes. Clear? There are two types of lymphocytes, B and T. T produce response against cell mediated immune response, and B is the humoral immune response, and is mediated by antibody, because when differentiation of B cells which takes this, they differentiated into two types, plasma cells and memory cells. And that plasma cells, see here, this is a plasma cells, and these plasma cells produce antibody. Clear? These plasma cells produce antibody. This humoral immune response are two types. Not humoral. When B lymphocyte will differentiated, they are of two types, plasma cells and memory cells. These memory cells they remember that infection later, and this plasma cell produce antibodies so that they kill that pathogen. Clear? And so that's why this is mediated by antibody and eliminate extracellular microbes and their toxin. They eliminate extracellular microbes and their toxin. This is a cell mediated immune response. What? Cell mediated immune response. This is a T cell, because cell mediated immune response are mediated by T cells. Clear? This is so what happened? They recognize peptide antigen on macrophages in association with major histocompatibility complex class. See, this is a antigen. Antigen are in the form of peptide, right? And these antigen are recognized by this class MHC. What? MHC. This is a major histocompatibility complex. They recognize this antigen on macrophages. Clear? And the processing will be takes place here. Antigen is processed. Identified molecules on cell surface helps body distinguish self from non-self. The main function of this MSC is to distinguish this antigen from self from non-self. Clear? What is the main function of this MSC? This is a major histocompatibility complex. They distinguish the molecules from self and non-self. If it is non-self, then the processing will takes place. Antigen is processed. The process antigen and class first MHC. This is the process antigen and class first MHC. Cytotoxic T cells. T cell are of two types, TC cell and TH cell. TC cell is the cytotoxic T cell, and TH cell is the helper cells. So this TC cells receptor recognize process antigen. This process antigen are recognized by this TC cell, right? This is a TC cell. Recognize this TC cells, and after that the process antigen recognize the process plus class first MSC. Clear? Then what happened? They activate helper T cells. Helper TH cell will be activated. Okay? Cytotoxic T cell become activated. Activated cytotoxic T cell process antigen and class first MSC, so that they produce molecules. They produce molecules like cytokines, this type of molecule, so that this antigen, the process antigen or viral protein will be killed off, and this viral protein will be die. These are the process. Clear? First, macrophages having a class first MHC, they recognize antigen peptide. This is self or non-self. If they are non-self, the processing will be takes place. They break down the polypeptides of the antigens. The processed antigen are recognized by TC cells. These TC cells recognized the process antigen and then they produce the cytotoxic molecules, right? Cytotoxic molecule are produced and this cytotoxic molecule kill that antigen. Clear this all process? So these are the process how the foreign antigen are killed. T cell goes into effector cells stage that is able to kill if infected cells. Effector cell stage and that is able to kill infected cells. Second, there are two types of T cells, T helper cells and T cytotoxic cells. So, helper T lymphocytes that recognize CD4 T cells activate phagocytes to kill microbes, and cytolytic T cells, that is CD8 plus T cells, destroy infected cells containing microbes or microbial proteins. What? CD8 plus T cell destroy infected cells containing microbes or microbial proteins. Clear this? So, cell-mediated immune response are primary response, production of a specific clone of effector T cells, and memory cell, production a specific clone of effector T cell developed in several days. This response developed in several days does not limit the infection. Secondary response more pronounced, faster, because why secondary response are faster? Because during the primary response, memory cells will be developed, right? Memory cells will be developed. So that during the second response, the response will be faster because memory cells will develop and they recognize that pathogen easily. More effective at limiting the infection. Example, cytotoxic reaction against intracellular parasites, delay hypersensitivity and allograft rejection. Now, second is humoral immune response. What happened in humoral immune response? It is a B lymphocyte. What? It's the B lymphocytes recognize a specific antigen. Humoral immune response are a B cell types immune response. Remember in earlier slides I told you this, right? So, B lymphocyte recognize a specific antigen, right? Proliferate and differentiated into antibody secreting plasma cell. Antibody secreting plasma cell. Antibody binds to a specific antigen on microbes, destroy microbes by a specific mechanism. Some B lymphocytes evolve into the resting stage and memory cells. See the diagram. This is the antigen, right? This is the antigen. This antigen, this antigen having a peptides, right? This is the B cells. This B cell having class 2 MHC. This class 2 MHC recognize this antigen, this is self or non. If it is non-self cells, then they process this antigen, right? During the processing of the antigen, this class 2 MHC break them into a peptide bonds in a small fragments, right? Antigen is processed. During the processing of the antigen class 2 MHC, processed antigen are displayed. The helper T cell activated. What happened? Helper T cell will activated. And when helper T cell will activated, this B cell differentiated into plasma cells and memory cells. And these plasma cells produce antibody. What? They produce antibody. So that these viral particles or antigen will killed out. And the memory cells that help in recognizing this infection for later time. Clear? Now, antibody. The antibody that produced from the B cells, what are the type? Belongs to the gamma globulin fraction. Antibody are also known as immunoglobulins. What? Immunoglobulins. It is antibody or Y-shaped structure or T-shaped polypeptides. It is a Y-shaped or T-shaped polypeptide. This is they having two identical heavy chain and two identical light chain. They having two identical heavy chain. This is a heavy chain and this is a light chain. And this is the Fab region where antigen are binding, and this is known as parato. Clear? And this is known as parato. All immunoglobulin are not antibody. All immunoglobulin are not antibody. There are 5 kinds of antibody, that is IgG, IgM, IgA, IgD and IgE. Clear? There are 5 types of antibody. So first is IgG. Actually IgG is having 70 to 75% of total immunoglobulin. What? 70 to 75% of total immunoglobulin and secreted in high quantities in secondary exposure. And this IgG cross the placenta. What? They cross the placenta. This is the only antibody that are present in a fetus, because this IgG cross the placenta. This IgG having a properties to cross the placenta and provide immunity to the fetus. Major function and application are they neutralize microbes and toxin, opsonize antigen for phagocytosis, activate the complement, protect the newborn. What? They protect because how they protect the newborn? The question will be asked, how the antibody IgG protect the newborn? Because this is the only types of antibody which cross the placenta and they protect the newborn or fetus. Clear? The fourfold rise or fall indicates active infection. A single positive sample indicates past exposure. Clear? IgM. IgM secreted initially during primary infection. During when infection will be takes place, then initially the antibody that are produced from our body are IgM, and after IgM, IgG will be produced. Clear? That's why IgM is the initial antibody that secreted from the body, or it is the primary infection. Question will be asked, which antibody are produced during primary infection? IgM, IgG, IgD, IgE. Then right answer is IgM. This IgM not cross the placenta because only the IgG, only the IgG that cross the placenta. The major function of the IgM is they secrete first during primary exposure and they activates the complement system used as a marker of recent infection. During the antibody test, they mainly test two type of antibody, IgM and IgG. According to this IgM concentration of IgM and IgG, they detect how long exposure will be takes to that particular antigen. Next is IgA. IgA is monomeric in serum. IgM is a pentavalent. What? They are pentavalent. Presence in newborn means infection. Single positive sample in serum or CSF indicates recent or active infection, used to detect early phase of infection. IgA. IgA is a monomeric in serum. Dimeric with secretory component in the lumen of the gastrointestinal tract and in the respiratory tract. Major function neutralize microbes and toxin. This is a monomeric in serum. This is the main function of IgA is in the gastrointestinal tract and in respiratory tract. And serodiagnosis of tuberculosis. During the tuberculosis, they detect the IgA. Synthetic respiratory viral test. IgD. IgD is the monomeric. It is also a monomeric. Only IgM is a pentameric, right? IgD is a monomeric. Major function and application is present on the surface of B lymphocytes. Function as membrane receptor. Main role of IgD is not clear. Has role in antigen stimulated lymphocyte differentiation, but main role was still not clear. Ig is the major antibody. It also mediate types. First, hypersensitivity. They respond against the allergy. When allergy will be takes place, then the concentration of IgE will be high at that time. And this is also present in monomeric form, and major application associated with anaphylaxis, and they play a role in immunity to helminth parasites. Sequential IgM and IgG humoral response. IgM produced as a first response to many antigen. Already I told you IgM is the first response, and IgG is the produced after IgM, or is called as second response. The level of IgM high transiently. IgG produced after IgM, and higher level persists in a small amounts throughout life. Produced in large amount during secondary response. During secondary response, the concentration of IgG will be high. What concentration? See this graph. This is the graph. This is the first time of infection, and this is the second time of infection. During the first time of infection, the concentration of IgM will be high, right? High. When the concentration of IgM will be low, after that the concentration of IgG will be high. But during the second response, when second time reaction infection will takes place, the concentration of IgG will be high. What concentration of IgG will be high? There is no increase in level of IgM. So first line of defense is IgM, and then after IgG. Clear? That's how IgG produced in large amount during secondary response. Persistence of antigen sensitivity memory cells after primary response. Failure of immune response. Immune response helps individual defend against microbes, some cancer cells. Right? Immune response can fail in hypersensitivity reaction and during immunodeficiency deficiency. In these two types, our immune system will be fail. Hypersensitivity reaction. Hypersensitivity will be act when allergy will be takes place. When our body reacts overreaction to an infection, that is known as hypersensitivity. Cause cells damage through excessive immune response to antigen, hypersensitivity overreaction to infectious agents, allergy overreaction to environmental substance, autoimmunity overreaction to cells, and immunodeficiency where our immune response will be fail, loss or inadequate function of various components of the immune system, and can occur in any part or state of the immune system. Right? The immunocompromised host has an impaired function of immune system, is at high risk of infection. Congenital, it is a primary immunodeficiency, and acquired, it is secondary immunodeficiency. Like AIDS, chronic leukemia, it is a secondary immunodeficiency. Clear? So, altered immunity, immunocompromised. This is the chart. Altered anatomic barrier, immune system, innate immunity, reduction of complement, activate phagocytosis, adaptive immunity. So, you see this table, and remember how the innate immunity, adaptive immunity will be work, and which cell will be acts, and what is the function. So in this PPT, what we study? We study about immunity, innate immunity, right? We study about innate immunity. It is the first line of defense, has no memory and non-specific mechanism. Second, adaptive immunity, developed entry of microbes into the host cells, and it has a memory to deal with subsequent exposure and happen to a specific cells, T cells, B cells, and having a memory cells. Third, primary immune response, that is by IgM, secondary immune response, that is by IgG, and failure of immune response can result in hypersensitivity and immunodeficiency. So these all are about the types of immunity that comes under the topic serology and immunology. So today we stop here. Hope this topic are clear to you all. Thank you. Hello students, today we discuss about the topic inflammation that comes under the serology and immunology. From name it's clear that is inflammation means the complex protective reaction from the body. That's known as inflammation. When some injury will cause in our body, or when some insect will bite, or when some iron rod will be injured in our body from iron rod, then and then a redness heat will be produced at that point where injury will be occur. That is known as a inflammation. What that is only known as inflammation. So inflammation is a complex protective reaction that is caused by various endo and exogenous stimuli. It's not only caused by exogenous, means outside our body. It's also caused by endogenous, like a tumor cells. Tumor cells, this all are inflammation that caused by endogenous cells, stimuli. So that cell division will be increased and increased without this stopping or without any checkpoints. So it's caused by both endo and exogenous stimuli, not only by exogenous stimuli. Injurious agents are destroyed, diluted, or walled off. Without inflammation and mechanism of healing could organism not survive. When inflammation will be occur, when inflammation will be occur at a point in our body, then there was a mechanism. Without that mechanism, there is no healing. There is no healing of that inflammation. If inflammation will be not cured at a particular time, then it will be act as a chronic. It will be very harmful for us. So from at a time it will be cured. Some inflammation cure itself only, but some some inflammation are not cured, that are treated by a several mechanism. It can be potentially harmful if inflammation are not cured at a particular time, from a time, then that inflammation will be act as a harmful. There are mechanisms of inflammation. First, local. In case of mild injury, there are three major type of mechanism. First is alteration, second is exudation, inflammatory exudation that produce liquid and cellular infiltrate, right? Third is proliferation, formation of granulation and fibrous tissue. Usually all three components not the same intensity. This all three components not act as the same intensity in all type of inflammation. Inflammation are categorized into several types. First, according to length, acute or chronic. They may be cured easily, that is acute, and they may be act as a harmful, that is chronic. According to predominant component, first is alternative, means predominance of necrosis like diphtheria. Diphtheria is alternative, and exudative. Exudative example are pleuritis. And third is proliferative, that is a thickening of the wall by fibrous tissue. If there is thickening of wall by a fibrous tissue, that is known as proliferative. Clear? That is known as proliferative. And predominance of necrosis is known as alterative. Okay. So, according to histological feature, they are classified into two types: non-specific and specific. In non-specific, not possible to trace the etiology. It is a vast majority. And specific like like TB, right? Like TB, specific. This is specific. According to causative agent, like aseptic. Aseptic means sterile, that are autoclave. That aseptic are a chemical substance, congelation, radiation, inflammation has a reparative character, and septic, that is caused by living organism. That is caused by living organism. Inflammation has a protective character. If inflammation are caused by a sterile material, then that are not too much chronic, right? Because sterile means they not contain any type of microbes. They not contain any type of microbes. Now first we discuss about acute inflammation. Acute inflammation, it is important role. Inflammation has microcirculation. It supply of white blood cell, interleukin and fibrin. When inflammation will be takes place, means some insects will bite at your at the body surface, then the white blood cells will come, interleukin, the number of interleukin will be increased and fibrin will be increased to cure that acute inflammation. So that inflammation are cured by white blood cells, interleukin and fibrin. Clear? Next is local symptomatology. What is the symptoms of the local inflammation or acute inflammation? There are 5 symptoms. There are classically 5 symptoms when inflammation will be occur in our body. First, heat, that is scientifically calor. So when inflammation will be occur in our body, if some insects will bite, or when rod are inserted in our body or touched from body, and there some cut will be present, then heat will be produced. First, redness will be occur at that point. What? Redness will be occur. Heat will be produced first, then redness will be occur at that point, and swelling will be occur. And that this all will be act as pain. What? Pain will be generated at that point. And loss of function at that point. There is mainly there is loss of function. So these all are the symptoms of local inflammation. If inflammation will be occur, these 5 symptoms will be compulsory. This is the classical 5 symptoms, that is heat, redness, swelling, pain, loss of function, and scientifically it is called as calor, rubber, tumor, dolor, functio lisa. Okay, so these are the 5 symptoms that occur after the inflammation. After this all, white blood cells, interleukin will the number of white blood cells and interleukin will be increased, so that they heal that inflammation. Now systematic symptomatology. Systematic symptoms, if inflammation are, chronic, then fever will become, irritation of center of thermoregulation, that is fever, the number of TNF and interleukin 1, interleukin 6 will be increased, high erythrocyte sedimentation rate. The number of erythrocytes will be increased so that this inflammation will be cured easily. For curing the inflammation, the number of WBC will be increased, RBC will be increased, so that inflammation will be cured rapidly. Second is leukocytosis. Leukocytosis means increase in the number of WBC, that is white blood cells. Increase in, if there is inflammation by a bacteria, if there is an inflammation by bacteria, the number of neutrophil will be increased. If inflammation will be taken by parasites, then eosinophils will be increased. And if virus inflammation will be takes place via virus, then lymphocytosis will be increased. So these are all terms according to the pathogen that cause the inflammation. If bacteria cause the inflammation, then neutrophil will be increased. If parasites cause inflammation, then eosinophil will be increased. And if virus cause inflammation, then lymphocytosis will be increased. Clear? Next is leukopenia. Leukopenia means decrease in the number of WBC. What? Decrease in the number of, in leukocytosis increase in the number of WBC. If the number of WBC will be increased, then the inflammation will be cured rapidly. If the number of WBC will be decreased, then there is decrease in time, so increase in the time for to cure the inflammation, because WBC act as a defense system. What? WBC act as a defense system for this pathogen which cause the inflammation, so that when their number will be increased, the inflammation will be cured rapidly. And if the number of the defense system will be decreased, then what happen? If the number of defense system will be decreased, what happen? If the number of defense system will be decreased, then the duration of the inflammation to cure will be increased. So there are just like viral infection, salmonella infection, and rickettsiosis. In this type of infection, the number of WBC will be decreased. Next is immunological reaction. In immunological reaction, increased level of some substance, that is C-reactive protein. If that inflammation will be not cured by this WBC or the molecules that are secreted, interleukin, cytokinin, then after that immunological reaction will takes place. Means there is increase in number of C-reactive protein. Means antigen antibody reaction will be takes place at that time. Now vascular changes. How there is a change in vascular. Vasodilation is the increased permeability of vessels due to wide intercells junction and contraction of endothelial cells. During the vasodilation, histamine, bradykinin, and VEGF will be increased, or these are released when vasodilation will be takes place. Clear? So vasodilation is the increased permeability of vessels due to widened intercells. Protein poor transudate means there is edema. Edema will be occur, means swelling will be occur at that point. Protein poor transudate means the transfer of protein at that point or translocation of the protein at that point will be poor. Means there is no transfer of the protein will be takes place. Protein rich exudate. Leukocyte dependent endothelial injury. If there is leukocyte dependent endothelial injury will be occur, then proteolysis, protein leakage will be there. Platelet adhesion. Platelet adhesion means thrombosis. Okay. What is cellular event? That is vascular events, now cellular events. In cellular events, leukocyte margination, rolling, adhesion and transmigration. Leukocyte, number of leukocytes will increase. The addition, there is the addition of that leukocyte and the transmigration to that inflamed surface. Next is immigration of neutrophil and monocytes. The immigration of neutrophil takes place from 1 to 2 days. What? 1 to 2 days. And immigration of monocytes takes place in 2 to 3 days. Next is chemotaxis. Chemotaxis is an endogenous signaling molecule. What? Chemotaxis is an endogenous signaling molecules. They act as lymphokines and exogenous molecules, that is toxin. Exogenous molecule is the toxin. Endogenous signaling molecules like lymphokine and every exogenous substance is act as a foreign substance or they act as a toxin for our body. Clear? Next is phagocytosis. Phagocytosis is the lysosomal enzyme free radicals oxidative burst. Passive immigration of RBC, no active role in inflammation, hemorrhagic inflammation. Now phagocytosis. Phagocytosis means eat the foreign substance and remove from the body or cells. That is known as phagocytosis. Phagocytosis is addition and invagination into cytoplasm. Means a foreign substance when occur, they act as inflammation. They act for inflammation. Then what happens? Cells engulf that foreign substance into their cytoplasm and they degrade that foreign substance. They degrade that foreign substance and remove from the body. Then remove from the body. That process is known as a phagocytosis. Next is engulfment and lysosome. Lysosome, what is the function of lysosome? The main function of lysosome is in the phagocytosis. They destruct that foreign substance. They destruct that foreign substance or remove or degrade that foreign substance so that they not cause inflammation further. And they destroy that foreign substance from the body and remove from the body. That process is known as a phagocytosis. In highly virulent microorganism can die leukocytes and not the microbes. In highly virulent, if inflammation will occur by highly virulent microorganism, then what happened? They can die leukocytes but not the microbes. Leukocyte will be die but that microbes will be not die in case of a highly virulent microorganism. In highly resistant microorganisms persistent within macrophage, activation after many years. They activate after many years. Persistent within macrophages and activation after many years. They activated after many years. Outcome of acute inflammation. Outcome of acute inflammation. Resolution. Restoration to normal, limited injury. What happened in resolution? In acute inflammation, chemical substance neutralizes in this normalization of vascular permeability, apoptosis of inflammatory cells and lymphatic drainage. You hear about the fistula. You hear about the term fistula. Fistula is also a type of inflammation, but it is internal inflammation, not by external. It is the internal inflammation in the gland, and this inflammation occur from a ear. And after that, when that inflammation will be increased in fistula, that inflammation will be increased. Then after 1 year, they appear outside the body, so that you see and know that there is something there is problem in our body, so that this small inflammation will be there. So there are several type of inflammation. Some inflammation will be seen from body after year or year, right? and some will be from today we there is a cut, then from 2 to 5 days that will be cured automatically. So there are several type of inflammation. So in this outcome of acute inflammation, first is resolution. In this what happened, chemical substance first neutralized, chemical substance released from body and they neutralize that inflammation, and normalization of vascular permeability, and apoptosis of inflammatory cells. The cells where inflammation will be takes place, that cell will be apoptosed. And fourth is lymphatic drainage. There is drainage of the lymphatic system. Healing by scars. Tissues of inflammatory cells. The cells where inflammation will be takes place, that cell will be apoptosed. And fourth is lymphatic drainage. There is drainage of the lymphatic system. Healing by scars. Tissue destruction. The inflammation where takes place in the skin. If inflammation will takes place in the skin, that is there is a dry scar will be present. That is a tissue destruction. What? That is tissue destruction. Fibrinosus inflammation. Fibrinous inflammation means if after when the inflammation will be like healing, at the time of healing there is a scar will be produced, right? That is nothing but a destruction of tissue or dead cells, right? And that indicate that inflammation will be cured. Curing will be takes place at that point. Third is purulent inflammation. Abscess formation means if inflammation will be not cured, there is pus. Pus will be present inside the inflammation. When we touch or press that point, there is a thick liquid will be released from at that point. That is the pus. That is a pus. That is pyrogenic membrane resorption. Pseudoxanthoma cells, weeks to months. That pus indicates that inflammation will be not cured. Progression into chronic inflammation means if pus will be generated, means that inflammation is progressed into chronic inflammation. So chronic inflammation, what is the reason of chronic inflammation? Persisting infection or prolonged exposure to irritants. If inflammation, if normal inflammation will be not cured or it is prolonged exposure to irritants, that inflammation will change into acute form of chronic inflammation. That inflammation is changes into acute to chronic inflammation. Repeated acute inflammation is changed into chronic inflammation. Primary chronic inflammation, low virulence, sterile inflammation. An autoimmune reaction, rheumatoid arthritis, multiple sclerosis, these are a autoimmune reaction. Means autoimmune reaction means our immune cells react to our body. They damage our body, not cure our body. That is known as autoimmune reaction. They respond to our body in damaging, not in curing. That is known as autoimmune reaction, and that is example of multiple sclerosis and rheumatoid arthritis. In primary chronic inflammation, if low virulence means low pathogen capacity will be present, that is known as primary chronic inflammation. Now chronic inflammation, in chronic inflammatory cells like lymphocytes, the number of lymphocytes, plasma cells, monocytes, macrophages, activation of macrophages, this all the number of this type of cells will be increased. The number of lymphocytes, the plasma cells, cytotoxic NK cells coordinated with other parts of immune system, so that chronic inflammation will be cured easily. Plasma cells, production of immunoglobulin. what plasma cells during after the differentiation of B cells, when there is differentiation of B cell, two types of cell will be formed, plasma cells and memory cells, right? And the plasma cell produce different type of antibodies to protect our body from the inflammation or other foreign particles. So there are several types of immunoglobulin are present: IgM, IgD, IgE, IgG. These are several types of immunoglobulin. Next is monocytes, macrophage, specialized cells, that is Gitter cells, mucophages, siderophages. These are specialized cells that also help in chronic inflammation. Morphologic pattern of inflammation. First is ulcerative, that is already I told you. Second is exudative, serous, fibrinosus, suppurative, pseudomembranous, necrotizing, gangrenous. This all are comes under exudative. And proliferative, in proliferative, primary and secondary. So first, serous. In this excessive accumulation of fluid, few proteins, skin blister, serous membrane, initial phases of inflammation. In serous, what happen? Excessive accumulation of fluid will take place. Few proteins like skin blister, serous membrane, initial phases of inflammation. This is the initial phase of inflammation. If excessive accumulation of fluid takes place, that is the initial phase of inflammation. Modification, accumulation of mucus. Next is fibrinous, higher vascular permeability. There is a permeability will be increased. That is also a role in a chronic inflammation. Fibrinolysis, resolution, organization, fibrosis, scar. Third is suppurative, that is accumulation of neutrophilic leukocyte and formation of pus, that is pyrogenic bacteria. In pus, what is there? Pyrogenic bacteria will be present or pyrogenic pathogen will be present. So that if you touch some bacteria will infect you, at normal surface also, right? Interstitial, diffuse. What happened here? In this, there is a diffusion of soft tissue and localized collection of, right? Localized collection. So formation of suppurative fistula. Fistula is a chronic. If they're not cured at a particular time, then that inflammation will act as a chronic inflammation. Accumulation of pus in preformed cavities, emphysema, gallbladder, thoracis. In fistula also, there pus will be present. When there is no cure of that inflammation at particular time, then pus will be formed at that inflammation, and they are released. So fistula are a cure at a time. Complication of suppurative inflammation, bacteremia. No clinical symptom. In this, what happened? There is no clinical symptom. Danger of formation of secondary foci of inflammation. Sepsis, septic fever, activation of spleen, septic shock, thrombophlebitis, secondary inflammation of wall of the vein with subsequent thrombosis, embolization, phymia, hematogenous abscess, and lymphangitis. This all comes under a primary and secondary types of inflammation. Bacteremia is a danger of formation of secondary foci inflammation, because there is no clinical symptom are present in bacteremia. So these are a very harmful or very chronic. Clear? Pseudomembranous. In this, what happened? Pseudomembranous is the example of diphtheria, corynebacteria. In this, fibrin necrotic mucus or etiologic agents are present. The number of leukocytes will be increased. Necrotizing. In this, inflammatory necrosis of the surface. Ulcer. Example are ulcer, right? Granulomatous inflammation. Distinctive chronic inflammation type. It is a cell-mediated immune reaction. What happened? It is a cell-mediated immune reaction. Cell-mediated immune reaction means it is a type of T-cell mediated immune reaction, and it is delay type. Aggregates of activated macrophages, epithelioid cells, multinucleated giant cells of Langerhans type X of foreign body type. No agent eliminated, but walling of intracellularly agents, that is TBC. Clear? What happened? Actually, granulomatous inflammation, it is a simply cell mediated immune reaction, that is delayed type of cell mediated immune reaction means in this T cells, it is a T cell mediated immune reaction, and in this there is activation of the macrophages. When inflammation really takes place, then there is activation of macrophages, epithelioid cells and multinucleated giant cells, so that the inflammation will be cured easily, right? They are caused by bacteria, parasites plus fungi, inorganic matter or dust, for foreign body particles, and unknown sarcoidosis. So from bacteria, that is leprosy, syphilis, TBC, this all are caused by bacteria, inorganic matter or dust, silicosis, and berylliosis. These are the types of inflammation that caused by inorganic matter or dust. And by foreign body, that is breast prosthesis. These are caused by foreign body. Tuberculosis, general term tuberculosis. TBC, nodule proliferative. What happened in this? 1 to 2 mm central soft yellow necrosis will be takes place, like a cheese like, and calcification will be takes place. Central caseous necrosis, amorphous homogeneous plus karyoretic powder. Treatment will be takes place by this type of chemicals, right? Tuberculosis accelerates serofibrinous exudate, that is by a macrophages. Leprosy. Leprosy is first present in Asia, Africa, in dermal macrophages and Schwann cells. Because in Schwann cells and dermal macrophages, they are air droplets, long contacts. They are transmitted by air droplets or long contacts. Eyelid destruction, faces leontina, and lephromatous infection will be takes place. Skin, what happened in this? Skin lesion will be formed, foamy macrophages plus viscera. Mainly there is no treatment of the leprosy. Tuberculosis, sterile. In peripheral nerves, tuberculosis granuloma and anesthesia will be provided, right? Dead secondary infection plus amyloidosis. In this leprosy, there is no cure of the leprosis. It is a very harmful disease. Next is syphilis. It is caused by a Triphonema pallium, that is spokites. It is STD type of a disease. Transplacental fetus infection. It also infected to a fetus. If mother and infected, then they are transferred to the fetus. There are three stages plus congenital. Basic microspial appearance are a proliferative endarteritis plus inflammation, when plasma cell will be in number of plasma cells will be increased, and they differentiated into a production of immunoglobulin. different type of immunoglobulin: central coagulative necrosis plus specific granulation tissue and fibrous tissue. Primary, there are stages of a syphilis. Primary syphilis, contagious. In male, in male penis and female vagina, cervix, it is a painless form ulceration, regional painless lymphadenopathy, and it is spontaneous resolve, weak and scarred. It is scarred. It can be resolved spontaneously after a week and week. Clear? Clear this? Secondary syphilis are contagious after 2 months, generally lymphadenopathy plus various mucocutaneous lesions. Condylomata later, anogenital regions, inner thigh, oral cavity. It is present at an anogenital region, inner thigh or oral cavities. So, congenital syphilis are abortus, infantile syphilis, late syphilis. These are types of congenital syphilis. In abortus, in abortus, pancreatitis pneumonia alba will be produced. In infantile syphilis, chronic snuffles will be produced. And in late syphilis, after 2 year duration, mulberry molars and saddle nose will be appear. So these are congenital syphilis are the chronic types of syphilis, and is a chronic type of inflammation. So this all topics are about the inflammation. I hope these topics are clear. Nothing but in this what happened, there are two type of inflammation. Acute inflammation, if that acute inflammation not cured within a time, then that acute inflammation will act as a chronic inflammation after duration of a time, and that chronic inflammation will be cured with the several different type of mechanism. There is an example of a fistula. This is also a type of chronic inflammation. So in this topic, there is no too much, but you have to read. Okay, thank you.